Hey guys, today we're going to go over my presentation for the barriers to diabetic healthcare. Okay, so I should be screen sharing now. So, perfect. So, this is the barriers to care for diabetics. What is diabetes and why should I care? So, diabetes is a condition that causes your blood sugar levels to rise. It's often characterized by the pancreas not producing enough insulin or not producing insulin at all. And it has two types of ways that insulin can be transmitted. There's insulin sensitivity and insulin resistance. Sensitivity is where your pancreas doesn't respond enough to and produce enough insulin. Resistance is where it doesn't produce insulin at all or doesn't use the insulin. Why should you care? We're usually going into healthcare professionals here in this course, um, usually an integrated health sciences major or nursing major. And knowing more about this topic will lead you to being able to better treat patients who have diabetes. And it'll just give you an overall better understanding of others. So, like, if your best friend was a diabetic, you would be able to look at them and say, I know what you're going through because I learned about what you're going through. So you just be able to better relate to others. There are 5 common barriers to healthcare for diabetics. There is the cost of care, access to quality care, stigma, lack of social support, and insurance challenges. For the cost of care, diabetes is very expensive. In my research, I read that it costs about $19,000 a year to get what you need for diabetes. And that cost does keep rising as inflation continues to go on. Um, Sometimes diabetics have to get a specialty medication. So in type 2, there is Jardiance, which can be very expensive. I had a patient one time tell me it cost them upwards of $500. Um, and for diabetics, there are little low cost solutions. So I know that recently insulin was supposed to be $25. Um, but oftentimes that's cheap insulin and it's not like Novolog or Humalog or a name brand like my fiance takes. Okay, and then access to quality care. So there's a lack of provider and staff education. So when you're talking about that, of course we have specialists, and of course, we have to study the pancreas at some point in our academic journey, but oftentimes that's like one short little course that we don't really talk too much about. So we need more providers that are better educated in diabetes and how to communicate with the diabetics. It's also really hard to find specialists. Again, we have a lot of providers out there, but most oftentimes we see them in primary care or ER med or surgical med. You don't see too many endocrinologists. In my hometown, there's about 2 within commuting distance. And for people in like rural America, that would be an issue because then you have a lack of transportation that plays into financial struggles. Um, and then when you do find a good specialist, it's hard to get in with them. It could take upwards of 6 months to be able to get an appointment. So that's also a big issue. It's also hard to find a provider that you really relate to. So it's hard to be able to communicate with some of these providers. And then for the stigma, there's a lot of stigma around diabetes, specifically type 2 diabetes, because a lot of people look at it and kind of link it with obesity when that's not really not really how it happens, or not the only way it can happen too, because that can be a cause. Um, so a big stigma is you can't eat that. In type 1, you actually can. You just have to be able to take the correct amount of insulin. And there's two types of stigmas. There's internal stigma and there's external stigma. Internal stigma is when you're looking into yourself and giving yourself feelings of shame and guilt when you don't really need to. Um, and then external stigma is from those around you. So you can't eat that would be an external stigma. And then another external stigma would be judgment. So, like I said, when people link type 2 diabetes with obesity, um, you are creating a judgment that may or may not be true. Uh, and that can kind of make diabetics weary of getting care, especially if they are overweight, because they can feel bad about themselves. So, external stigma can cause internal stigma. And then internal stigma, the shame and guilt. I know that my fiance, we talked about this in our interview. He doesn't enjoy taking care of himself sometimes or taking care of his blood sugar sometimes because he feels feelings of shame and guilt about it, especially when he has to ask me for help because he feels like he should be able to do it himself. Then there's a lack of social support. There aren't many support groups around for diabetics. Most oftentimes, people need to be able to feel support from others, and unfortunately, that isn't always the case because either family is unaware or they're not educated on the issue that somebody who has diabetes is going through. They could also be embarrassed, and that goes with my can't afford supplies point. So if a diabetic, say, needed a vial of insulin and that's $125, you don't want to look at your friend or your family member and go, hey, I need medication. It's $125. Do you think you could help? So that would cause an embarrassment. Insurance challenges are a big thing over the board. Insurance is a very flawed system, um, unfortunately. But I looked into the insurance marketplace recently. There's three tiers. There's bronze, silver, and gold. Bronze is the lowest tier. It's a high deductible, high copay. High copay. Gold is the low deductible, low copay, highest tier you can go. The big problem is the bronze, which doesn't cover anything. It's $40, and then the gold is $450. So, in diabetes, there's also a lack of representation in health insurance. So, for some, they might cover one hospital visit a year for if they have admission, or they might cover one insulin, but not the other insulin, but the other insulin works the best for you. I know my best friend's mom, she's a diabetic as well. And unfortunately, she has to use Dexcoms and she can't access those Dexcoms because her insurance only covers a freestyle. So that's where the lack of representation for insurance comes in. Then there's strict Medicaid requirements when you do when you do need to get into Medicaid. And those requirements are like financial, you have to be low income. Sometimes they cover it if you have a disability. So there's just really, really strict requirements to get into Medicaid. Some common themes that I saw in my literature review: low health literacy. We need people to be more aware of their wellness. Um, Health literacy is a big thing. You need to be educated. So those lack of education and health literacy tie together. So you need to be able to know about your health, and your provider needs to be able to know about what's going on as well. So if you have low health literacy, that can make it extremely hard to be able to get care. Patient experiences. I read a study for patient satisfaction ratings, and we found that communication with the provider is oftentimes leading cause of low patient satisfaction. There's a lack of specialists. We talked about that. There's not enough people to treat the diabetics, and there needs to be more. Scheduling policies being too strict. It can take 6 months to be able to see a specialist. And lack of healthy food was also discussed in my literature, which, it's $5 for a meal at McDonald's, $45 to eat organic. That needs to be fixed. How did I conduct my research? I did 2 interviews, one with my fiance, Jacob, and one with Dr. Sabaya, the cardiologist that I work for. For Jacob, in our interview, I found 4 key moments that I really like to discuss with you guys. We have the don't die story. Jacob used to do healthcare himself, and his insulin pump would beep, and his coworker would go, "Don't die," every time it would. And that kind of made him feel that stigma. He felt that external stigma, and then it went internal because then he felt shame and guilt about his insulin pump going off. Don't eat that is another thing that we've talked about already, but it ties in here as well. He had a time where he was in the hospital, and he was sending me to go get Chick-fil-A. He was coming off of a diabetic episode. And I asked the nurse if I could give him Chick-fil-A, and she was like, "That's probably not the best choice." And the other nurse, so sorry. The other nurse was like, "No, he actually can eat that, but he has to take insulin for it." And so that's where that stigma comes in as well. And then we talked about the financial access and expensive CGMs. So Jacob had a time where he was, he had used all of his Dexcoms and come to a point of, needing to get a refill from the pharmacy. The pharmacy was good with refilling them. He made it all the way there. And when he got there, they informed him that insurance would not be covering it because they weren't ready to cover it. And he had to spend he had to spend $300 on a CGM, which is astronomical. And had he not had the resources, would have been very, very bad, because then he wouldn't have been able to check his blood sugar. So for the average person, that's a problem. And then it's hard to find decent health insurance. We spoke about this as well. In diabetes, the lack of representation in health insurance is very, very true. When working with diabetics, you'll find that insurance covers one thing, but not the other thing, and that's a problem. And then with Dr. Sabaya, we had I'm so sorry, my phone keeps going off. Then with Dr. Sabaya, we had some very common themes as well, which was the lack of representation in healthcare. Our doctors are very smart. They're very well educated. But we talked about how diabetics in general aren't really represented well in healthcare, and how that could be improved. We spoke about how patients who have diabetes can be characterized, and the stigma that surrounds that as well. We also talked about the lack of specialists. Again, we were talking, and he said, there's you can find a cardiologist close by. You can find even an audiologist close by, but endocrinologists aren't very well distributed throughout this area. So we need to get more specialists in the area. That's what we were talking about. Access to care. We talked about how patients need to be able to access care. It needs to be affordable. And that we feel like we need to get this together as a nation. And then again, that goes into our policy change. And we did discuss a policy change. It's actually one of my ideas and my solutions. So I'll go over that here in just a sec. I've come up with 2 solutions to try and help combat stigma, lack of access, quality education, health literacy, cost of care, and insurance challenge. For a policy change, I would like to create a new policy. This is the one that Dr. Sabai and I had come up with together. This is kind of a universal healthcare for diabetics. It gives them access to all healthcare at a low cost. But I'm so sorry, instead of just focusing on the treatment of the acute condition, it focuses on the long term as well. So in this program, we would have low cost treatment, low cost medication, and a low cost follow up. So it's kind of just a universal healthcare for diabetics. If you have diabetes, you can enroll and make sure that you're getting the correct and proper care that you need to be getting. And then it is a short program for all involved. I would like to create that as well. It would be distributed by providers and diabetes educators to inform staff, providers, family, friends, anybody involved with the diabetics care to, better understand them, be better educated on the condition, know how to give medication better, and just give you a better knowledge on diabetes and the challenges that they face. I know here in this course, we've spoken a lot about barriers to care and challenges and stigmas and all sorts of stuff. So I feel like that's going to greatly help us understand not only diabetics, but the population in general when discussing healthcare. So that's it. Thank you so much for watching my presentation. I do really appreciate it, and I hope y'all have a great rest of your semester.